This video is going to show you how to treat the hand joints with some mobilization techniques as well as some nerve mobilization. So for this first mobilization, the base of the thumb is the carpometacarpal joint, and there's basically a bone that goes from here to here on the thumb, a second bone that goes from here to here, and a third bone that goes here to here. So we want to grab this first bone right above where the wrist joint is. So we're going to hold the thumb in our hands, not here, but at the base here, okay? And then what we're gonna do is grasp it and just push it down and up in this direction. Before we push it down and up, we actually want to pull the thumb out from the wrist. That's called distraction. So it's just gonna separate the joint a little bit to make it a little less painful. So we're just grabbing the base of the thumb, pulling it out away from the wrist, and then we're just kind of moving it back and forth into an anterior posterior direction like this. I'll show you one more angle. So if your hand's flat, you're just grabbing the thumb and you're pushing it down to the table and lifting it up towards you, back and forth. It's kind of like a half dome semicircle motion, just because that's how the joint is situated. And we want to pull out first, and while we're pulling out, we're pushing up and down on that joint. The next thing that we want to do right after that is do thumb opposition. So we can have our hands here. We're going to reach as far as we can toward the base of the fifth finger and back over again. So if you can only go here, then it would look like that. If you can go a little further, or all the way. So we're going to do that. We're going to do some exercises for the hands. The first one is just going to be keeping the hands straight, and we're just going to bring the top fingers up, down, like that. Just like it's called a tabletop exercise. Then we're going to press with the finger into the first and second contact. And then we're going to do the same with the first and third contact. We're going to push for 5 seconds, relax, then first to fourth, push for 5 seconds, first to fifth, push for 5 seconds. So we're working on not just range of motion, but strength. Then we're going to work on the key grip. So a key grip is like if you were to hold a key in your hand, that type of grip. So we're just going to press the thumb into the second finger and hold it for 5 seconds and relax. Press the thumb into the second finger and hold it and relax again, 5 seconds each time. And all of these, you can start with 5 repetitions and work up to 10 repetitions over time, just to kind of build your endurance of these muscles. The next one is just focusing on this grip. I know we did it with all fingers, but specifically, this is a very important grip. It's like the OK sign, and functionally, we use a lot of strength this way functionally. So we're just gonna hold this for 5 seconds and relax. And you're squeezing as hard as you can on both sides before pain onset. So you wanna try to really push down and relax. So that's that one. There's one that you can practice on a table like this, and all the fingers are in, all the fingers are out, stretched as far as you can. All the fingers are in, all the fingers are out. So those are some of the exercises, and for level 1, just do as many as you can before pain onset. So maybe 5 repetitions, and then you can progress later on to 10 repetitions as you're able to. Start with 1 time a day. If that feels okay, you can go to 2 or 3 times a day for these exercises. The idea is just to keep moving your finger joints and strengthening them. And then you can add 2 nerve mobilization exercises, which I'm going to show in the next video.